Dr. Gold likes this laser for pseudofolliculitis barbae. And he goes on to say that it benefits his PFB patients in three areas. The wavelength is very safe with dark skin types. The laser is compact, lightweight, only weighs, I think, like 20 pounds. And, you're able to, and it wheels, and you're able to kind of wheel it from room to room. Some people carry it if you have different offices. People have told me they've carried it to different offices. And it's just very easy to move around your office. And again, we talked about the pulse engineering for pain-free removal. This echoes Dr. Campbell Chambers. She did a lovely article in the JAD Anti-Aging Medicine for pseudofolliculitis barbae. And for her, it's her top desirable laser for treating that. Permanent hair reduction. So using this for PFB, there's also a wonderful benefit because you can use this for permanent hair reduction. So in this study from the Journal of Global Dermatology, looked at 298 subjects who were treated with the 650 microsecond 1064, and 85% were satisfied or highly satisfied with their results. So it's definitely a safe laser. Here in California, hair removal laser is probably the number one complication that we see in the aesthetic realm. And this certainly, using this laser really will decrease those numbers. So now let's talk about PFB a little bit. And Dr. Campbell Chambers says that in her practice, the Neo is revolutionary for PFB. And ironically, she sees more females than men who come into her practice for that. And I would say that as well. In terms of practice building, this is a population, a subset of patients really which have been invisible. Women tend to hide their PFB under thick concealer and not discuss it. So this is a real opportunity to grow your practice, to start looking at the chins of our female patients, especially our female patients, skin of color patients. There is a little higher incidence of PFB in the skin of color female than the Caucasian female. So, just start looking, and, you'll be able to offer this treatment. And your female patients are so grateful that, one, you noted it, you brought it to their attention, and then you've got a way to treat it. So I highly recommend looking for this, because this is really a home run, and you can get this chin area completely smooth and, bump-free and pigment-free. Here are some cases. This is from Dr. Henry, before and after 3 treatments. Here is a beautiful case from Tesoro, and you can see the resolution of the hair when you look up to the cheek. The hair is gone, and the PFB on the chin. And if you look down to the neck, the PFB on the neck area is also gone. So, really nice results right under here to here, resolved, and then this looks really nice. And similar to the other results, you can see there's just an increase of youthfulness to the skin and texture. There's these textural changes that happen from, collagen remodeling that really makes the skin look younger and healthier. Here we have a significant clearance of PFB. Just always remember, when you're treating PFB, you have to, warn the patient that the hair removal could be permanent. So if they want to, grow a beard or wear a shadow, this may not be the treatment for them. I find most of my patients with PFB are willing to forego the beard and the shadow for having skin that looks like this patient. This is a patient of Dr. Hepburn, and this patient is very happy, after 3 treatments, and probably, does not care that he cannot grow hair there anymore. But I do recommend everybody asking. Dr. Burgess likes to use, this is her to-go-to laser for PIH, and, patients who have come in to her from burns, which we spoke about earlier, from, hair removal and PIH due to other trauma. She has a protocol where she uses the Neo, and she uses it in combination with chemical peels, and she's able to get rid of the PIH. So here are some examples of this. This is a female with major, acne scarring on the right cheek and PIH. She had 2 treatments and was able to obtain this result. So this is pretty impressive. 2 treatments with the Neo, and this area is really completely resolved. We see a little bit of a footprint here, but this area is resolved, both the scarring and pigmentation. And again, look at the texture of her skin in this area compared to here. It's just a smoother, nicer texture. Look at the pores here versus here. So again, when you're doing this, you're going to be treating globally and then focusing on the lesion. Next case, this is something you never want to see. And really, for the record, IPL should never be used in an African American patient, okay? There are lots of great studies in IPL in the Asian literature, and, great studies, and IPL has worked really well in, the Asian skin types. But for an African American, we don't completely know why. Perhaps it's just a lot of energy, which is focused on the epidermis. And earlier we saw that, the focus of the IPL is really on the epidermis, and this really disrupts the pigment and can cause a lot of PIH and scarring. So this is a patient of Dr. Burgess's, and when she used the Neo in combination with hydroquinone and some Gesners, and got this result, which is pretty, remarkable for this type of lesion. And so just remember that you can use this, the Neo, for PIH following any kind of burn, especially an IPL burn. If someone really wants to keep their beard, I would just do very low, settings. And the permanent hair removal is done with not in one session. So it takes multiple sessions. So I would do very, low fluence. I would do very low settings and monitor, the hair growth. Because if you're seeing, the patient back, let's say every 4 weeks, you'll be able to monitor. Now, the key with hair removal laser is that you don't want the hair to recover from the assault, okay? So in the old days, it would be, see your patient back in 8 weeks, right, to do your second session of hair removal laser. But you don't want to do that, because then the hair, the bulb, has time to recover. Basically you're assaulting the hair follicle. And you don't want a recovery. You want to hit that hair, as much as you can, every 2 to 4 weeks, 4 weeks tops, because that's how you're going to affect permanent hair removal. So some of the failures in permanent hair removal is because it's been too long that the hair is able to recover. So in that case, I would, where you want to keep the hair, I wouldn't do it every 2 weeks, because if you do it every 2 weeks, you're probably going to, permanently remove that hair. I would do it every 4 weeks. It would take longer to achieve the results, but the patient will probably be able to keep most of his beard hair.